Hi guys, this is Dr. Rabinovich of Dental Muse again, and I received a question this week asking, why is a dentist talking about sleep apnea? Great question. And the answer is easy, because we can help. And it doesn't involve putting a Darth Vader mask on your face. Now, I'm not knocking CPAP machines. They work, they help save lives. The problem with CPAP machines is that they have 40 to 60% non-compliance rate. What that means is roughly half of the people who are prescribed CPAP machines cannot tolerate it, can't wear it, can't sleep with it. And unfortunately, medical community just doesn't have anything else. That's why I'm so proud to be in the profession that helps fill in the gap with an oral appliance. FDA approved use of oral appliances in treatment of mild and moderate sleep apnea and severe sleep apnea for patients who cannot tolerate a CPAP machine. Now, an oral appliance, there are many of them out there, and they generally fall into one of two categories. MAD, which stands for mandibular advancement device, and an expander. And mandibular advancement device essentially takes a cue from what your body's naturally trying to do when you grind or clench your teeth at night. You essentially try to get your jaw out of your airway. So what a MAD appliance is, it's an upper and lower bite plates that are connected. And it's that connection that moves your jaw forward slightly to open up that airway. And it's great, and it works immediately. It offers immediate relief and better sleep. The problem with the MAD appliance is that over time, the bone here can recontour, thus permanently changing your bite. And so my concern with that was, well, wait a minute, I'm giving this appliance to the patient and tell them that they may not ever be able to chew comfortably. And the answer to me was, well, because breathing and not dying at night is more important than chewing. Now, as a healthcare professional, I understand that. I get it. But there are members of my own family who will disagree with that statement. So it made me look further, and I found the other group of where appliances fall into, and that is expanders. Now, expanders isn't anything new. They've been around for decades. Dentists have been expanding adult patients for decades. What's unique about the appliance that I'm using, it's called a DNA appliance. It has a 3D expansion, not just lateral like most of the expanders are, but it also expands you towards the front. Now, we're not talking about giving everyone a horse face. We're not talking about expanding you in inches, but in millimeters, because 1 millimeter movement towards the front, we're talking about opening up a 3D volume in the back. So small movement towards the back, towards the front makes a huge difference in the back. And I'll show you an example of that. This is actually my husband's appliance. So let's see if I can show this. So it has these two gears, one gear that expands towards the front and another gear that expands towards the front. One gear towards the back and one gear towards the front. So you can see these Y splits. So this brings the jaw forward and this brings the jaw to the sides. He is sleeping with the bottom appliance also, so it does incorporate certain elements of a MAD appliance because growth takes time, especially in adults, whereas we need somebody to start sleeping better right away. So the concept is essentially this. It's hard to imagine this without teeth, but imagine that this goes on top and this goes on the bottom, and kind of the bottom hooks up to the front, bringing the bottom jaw slightly forward. It looks cumbersome and like a lot of stuff, but if my husband can get used to this, so can anybody else, and I promise this. And I'm gonna show you something really quickly. I have my kids in appliances too, because and some of you have heard me tell this story before, I've literally watched my then 7-year-old stop breathing at night, and she had her sleep test in Children's Hospital, and it showed that she does not have sleep apnea. And I couldn't believe it. And the ENT called me with great news. Hey, she doesn't have sleep apnea till next time. And I'm like, well, what do we do in the meantime? She's not breathing well. She's waking up groggy. She needs 10 minutes on the couch before she can start functioning again. She's not breathing well. She's not doing. This is not okay. So again, going back to my previous video, those tests are limited. She would still stop breathing, just not long enough for the machine to register it as an apneic event. So I have her in this little appliance. It's called a growth guide for the kids. There's this little tab here that trains your tongue to be at the roof of your mouth, which is where you want your tongue to be. Because essentially you want your palate to be flat, which is why expansion is so important. If the palate is flat, your tongue can perfectly fit in there. That's why when you go to sleep, it functions like a suction. So it keeps your tongue in place. If your palate is vaulted, like most of us have it, The tongue can't fit in there, and it can go in the only direction it can, and that is backwards, obstructing your airway. So the kiddos have this tab, teaches them to keep the tongue at the roof of the mouth, and this is just a growth guide. They're growing, so we don't have to do much intervention other than guide them in the right direction. And this little appliance, same thing, but this is for really little ones. So I have my 18 months old in it. She's actually 17 months. So this is something that I just have her chew on for a few minutes a day, 10, 15, however long I can get her to do it. Same thing, she sucks her thumb. She already has a vaulted palate. I don't want her to end up not breathing at night like my oldest, so I have her in this little one. Hopefully this answers some of your question, and of course, reach out if you have more questions. We're always willing to answer them. Have a good one. Be safe.